Essentially, if we look at those models, they're really built on preventive and primary care. And I think we have an incredible healthcare system, but we're really, really good at the complex cancer care, transplant, trauma, all of those things. But where we haven't invested enough is on the front end of care, which is preventive, primary care, comprehensive. Let's think about COVID, but let's rewind the tape and say that all 330 Americans had great primary care. And it doesn't mean just a primary care doctor, but a place where they went and had comprehensive longitudinal care and were able to get it regardless of their ability to pay. I would say that today as a country, we'd be in such a better place than we were a year and a half ago.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to Alvarez and Marcel's podcast series, What's Your Moonshot? My name is Peter Urbanowitz. I'm a managing director at Alvarez and Marcel and the co-head of our healthcare industry group. I'm here with my co-host, the Honorable David Shulkin. Dr. Shulkin was the 9th Secretary of the U.S. Department of Veterans Affairs. David, I know you join me in our pleasure of welcoming our guest today, Dr. Rod Hochman, to this episode of What's Your Moonshot? Dr. Hochman is the President and CEO of Providence St. Joseph Health. He's also currently the chair of the American Hospital Association. He's a leader in American healthcare. He's been included for many years on Modern Healthcare's annual ranking of the most influential people in healthcare, and was named one of Modern Healthcare's 12 disruptors in healthcare. Dr. Hochman is the recipient of the Gail L. Warden Leadership Excellence Award by the National Center on Healthcare Leadership. He was named the 2015 Innovator of the Year by Press Ganey and the 2017 Partners in Care Foundation Vision and Excellence in Healthcare Leadership Award. Dr. Hochman, welcome to our episode today.
Great to be here with both of you.
Great. Rod, thanks so much for being here today. I think when all of us are going through the types of times that we are, things are happening so fast and so much around us, we look towards those voices in the community that can really give us perspectives on things. And there's no doubt that you're one of those voices that I look to try to figure out what's not only happening, but what are the opportunities out there. So over this past year and a half, and I know you've been asked this so many times, I just thought it'd be good to give our listeners just your perspective now as you sit here in, almost the beginning of September of 2021. What's your perspective on what the pandemic has done to healthcare and what you think that's going to look like moving forward?
Wow. As you know, David, we had the first case of COVID back in January 20th of 2020. And from then, it's just been a complete journey all the way through it, as it has been for the whole healthcare system. And we had a number of issues. I kind of divide the world up into AC, BC, DC, and AC, before COVID, during COVID, and now instead of after COVID, I've termed it KAC, kind of after COVID. So kind of what does the world look like? And before we went into COVID, we had a number of problems that we knew in healthcare, right? Mental health, big issue. A lot of issues around affordability, how are we going to get through all of that? A lot of issues around health equity that I think some of us realized. I think what COVID did was put a really bright light on all of these issues that we've had, and it's really exposed our vulnerabilities. What does our public health system look like? Is it really there? Are we capable of doing it? What are our capabilities as it relates to the supply chain and taking care of people? And how quickly are we able to respond? All of these things kind of really got to be a bright light. And I remember giving a talk about, it was now probably 4 years ago, and I said I was worried about 2 viruses. And the first one I said were cyber viruses, and the whole audience nodded, and everyone kind of got that one. And I said, the second one's RNA viruses. And you know how something lands like a dull thud, right? And I was like, well, what do you mean? Like, well, I said like SARS or MERS. And they kind of nodded their head and said, oh, yeah, whatever. But, the kind of the understanding that the inevitability of COVID, I think a lot of us, yourself included and others, said at some point we're going to deal with this. So all of those things added together, but kind of pointed out, I think COVID pointed out this, what I call the six major instabilities in healthcare, but in other industries. One of them is biologic instability, that we're going to have to deal with all of that. And I think everyone kind of gets that now. The second that it brought up is the financial instability of both healthcare, the healthcare system, but also of the economy in general. And it was really highlighted, obviously, through COVID. The third that doesn't get as much attention has been the environmental instability that we're dealing with. Today, look at our friends in Louisiana and then our friends in California that are dealing with fires. And we froze out Texas last year, but it had a profound impact both on the healthcare delivery system, but also on the patients that we're caring for. The fourth that you're no stranger to is political instability. And those of us in the healthcare, we tend to be politically agnostic to party, but it's been really hard to navigate through these waters trying to figure out what's the stability of where we're going to be next. The fifth that came up that you and I knew about before COVID was the whole issue of healthcare inequities. And those COVID really put a bright light on and said, oh gosh, look at the differences that we're seeing here. So all of these factors together really have kind of created this. The last one that I'd add to the list, which became evident during COVID, is cyber instability. So we kind of knew about cyber before, but if we talk to our friends at Scripps and others, it actually got heightened during COVID. So that's kind of what we've all been spinning around. Now, with all that gloom and doom I just said, what's there to be hopeful for? I think the cooperation amongst healthcare people around the world has never been better. From a scientific standpoint, I trained as an immunologist. It's never been a better time because literally we're on the phone all working the problems together. That part of it's been amazing. The resiliency of the healthcare system under stress has been shown to be pretty good. So there's a lot also to be thankful for as we go forward. The question is, are we going to learn enough from COVID as we eventually exit?
Right.
Rod, with these pandemic headwinds in mind, how have they informed one of your moonshots, which is to provide free primary care access to the communities you serve? Do you view this moonshot investment as both serving the people you provide healthcare to, and is it part of your business model?
I think it's both, but it's also should be part of the nation's plan, right? Because I think a lot of us have read the recent article that said, why is healthcare in Costa Rica better than in the United States, right? As we look at outcomes and we look at all of that. And essentially, if we look at those models, they're really built on preventive and primary care. And I think we have an incredible healthcare system, but we're really, really good at the complex cancer care, transplant, trauma, all of those things. But where we haven't invested enough is on the front end of care, which is preventive, primary care, comprehensive. Let's think about COVID, but let's rewind the tape and say that all 330 Americans had great primary care. And it doesn't mean just a primary care doctor, but a place where they went and had comprehensive longitudinal care and were able to get it regardless of their ability to pay. I would say that today as a country, we'd be in such a better place than we were a year and a half ago.
Well, Rod, let me follow up on that. First of all, I love the fact that you're putting that out there. It takes big ideas and dreamers to be able to move us the way we need to. So how do you begin to think about actually seeing that realized? Is it something that you think as big as a system as Providence could do on its own? Or do you think that this is something that's going to require public-private partnerships? We're going to need tech companies to come in and help us do that. I mean, how are you, because you're in this wonderful place in representing and chairing the AHA and being a thought leader and then running a large system. How do you think about putting this together?
So I think it takes both, right? So you gotta, as you know, demonstrations are always good, and we're a big enough system that we can actually do that. And we've kind of created what we almost call a pseudo capitation model for primary care, so that the primary care physicians could just think about comprehensive primary care without having to worry about how many times I brought the patient in, DRGs, all the things that we know are an anathema to primary care and being comprehensive about it. But ultimately, it's going to take the commitment of private and public partnerships. Now, what I always say is that when we talk about value-based care and we talk about comprehensive care for everyone, for everything, it becomes overwhelming. But if we just talked about the primary care side and said, what would it take to get every American good primary care? Primary care is, as you know, David, it's not the expensive part of care. It's actually the low end. It's actually pretty cost effective. It's not a big part of the premium dollar. So that's a good thing. But we got to get everyone to agree on the private side and the public side that we're going to essentially capitate primary care. And for those that can't afford to go there, they're going to get a free card. And I think in a lot of ways, as we talked about Medicare for all, how about primary care for all as a starter? Wouldn't that do a tremendous amount to transform the health of this country? So I think you have to do both. You need some demonstrations that can show conceptually that it works. The other side of this is that it will dramatically and revolutionize primary care. When I talk to primary care doctors about this, I get a standing ovation, because this is the way they really want to practice. They want to practice in teams. They want to take care of mental health problems. They don't want to be on a how many visits per day trap that they're in now. And basically what it lets us do too, the amount of innovation that we would have in the primary care model under this plan would also be fantastic for the country and for healthcare.
Yeah, no, Rod, I couldn't agree more. Sounds a little bit like the VA healthcare system.
Yeah.
But we can talk about that later. But I agree with you.
But David, right? You saw the possibilities, right?
Of course.
And there, as you and I both know, there's really a lot of good that happens there when you have that kind of system. The question is, how do you expand it? Are you able to do it? But I always looked at that the same way I look at my friends at Kaiser. The thing that Kaiser itself has really gotten right has been that front end of care. They've really been able to make it happen and be able to do it.
Absolutely. Thanks. I just wanted to follow up on one other thing, and that is that you talked about one of the risks kind of post-COVID is the environmental instability that we've seen. And you've been bold enough to put out there another moonshot, and that is to be carbon neutral by 2030. Is that feasible? Is that aspirational? Tell us about that moonshot.
So it's actually even more, it's to be carbon negative by 2030.
Oh, carbon negative.
And if you look at healthcare in the whole energy sector in terms of our carbon footprint, it's like in the 18% range. We are a big part of what's out there. So comprehensively, we've said we're going to do that. And we've broken it down into a couple of components. So one of them is the energy component. And I think we're over 10 of our hospitals are now on alternative forms of energy as their sole source of how they run every day. Then another big part is just our waste profile that we have, which is incredibly significant. One of the things that our folks have brought up is the use of anesthesia gases. That by converting your anesthesia gases, we actually really save the environment incredibly by doing that. So there's a whole bunch of things that we can do already that we think it's entirely feasible to get there. And obviously for a larger system like ours, we got more resources involved, but we really think there are a number of steps that even small hospitals and systems can take to get us in that direction. So We think it's one of those things that's going to get more attention as we move forward. We've talked with the National Academy of Medicine and really have said, what is the carbon footprint for healthcare? How do we reduce it? How do we make it better? And our goal is to make, Providence the example for the country in terms of how to do that.
So Rod, you talked about the first letter in something that we hear a lot about and read a lot about, and that's ESG and an organization's ESG profile, environmental, social, governance. How important do you think this is to an organization, especially a healthcare organization? And what is your organization doing about it? And as the leader of the AHA, what are you encouraging other organizations to do about their ESG profile?
Yeah, I think what it takes is a consciousness and awareness of it, right? And particularly for us as being a faith-based organization, it's always been part of our DNA in terms of it. In a lot of ways, everyone else is catching up to it. But taking a stance on the environment in particularly is critical to who we are. I mean, we've got to be able to do it, and it's so impactful. But I'd say we've taken the same stance as it relates to the whole equity issue, equity of care, that now, everyone's discovering equity. And we said, look, we've been on this for a long time. And I think, we've been staring at that issue in healthcare. We've known about it, but we really haven't acted on it. And it's almost equivalent to the crossing the chasm on quality that we went through a decade plus before, we kind of said, well, we can't do anything about these things, and we kind of discovered we can. I think we're discovering the same thing around equity of care. We know the gaps in cancer care, we know the gaps in other things. Now we're, I think, at a phase where we got to do something about it, and we got to put both our money and our efforts where our mouth is. And, that's where we see, and I see myself in terms of the AHA being on the bully pulpit to push these issues and make sure they're part of what we do. And we think they make great economic sense, but there are the right things to do.
Rod, we could spend the next hour talking to you. You're doing so many interesting things, not only in your leadership position at Providence, but your leadership position, healthcare at large. And I think our audience has seen why you are a leader in healthcare. David?
Rod, just thanks so much for what you're doing, not only for Providence, but really for leading the country through the AHA efforts and for dreaming big. And thanks for joining us today.
And I would say to both of you, and you've both been so intimately involved in a lot of these healthcare issues. You got to remember when as dark as it sounds, we take care of one patient, one family at a time, and every one of those is just an incredible event. And I've been buoyed by the fact that when I turn on the TV and you see the natural disasters and you see COVID, I've never been disappointed in a doctor, a nurse, a technician, and their commitment to taking care of people. And I think that's what keeps the three of us coming back and staying in the game. So thank you so much for giving me a chance to talk, and great to be with you.
Thank you, Rod.
Well, Rod, thank you so much for being on our program today. And thank you to our audience. Thanks for listening to this episode of What's Your Moonshot? You can find additional episodes in this continuing series on our website, alvarezandmarcel.com. Thank you.
Alvarez and Marcel. Leadership, action, results.
I have to tell you, I'm really excited about our listeners having a chance to hear from Rod Hochman. I think he really is one of those voices out there that gives people hope and puts out a vision for what healthcare can be and should be.
No, I agree. And Rod made a very important point too. Look, we have so many systems out there, and they are faith-based systems. And, we have some great words that we use right now. And I brought up the whole ESG concept, which is really, it's the de rigueur. It's everyone wants to talk about that. But we have organizations out there, they've been functioning like that for the last 100 years. They've been worried about their social mission They've been worried about the environment. They've been worried about governance in terms of being very inclusive on who they bring on to lead their organizations. So, it's kind of funny. It's like everything old is new again. There are many, and I think especially in the healthcare space, they've always been committed to those things. And so it's not new to them. And it's great to hear what he's doing in that space.
Yeah, I think that's a really good point, Peter. I do think that what Rod is able to do is to take something that's impacting everybody, the pandemic, and to translate it into meaningful goals that are going to move healthcare forward. And this concept of free primary care for everybody in the country, I think when you look back upon the fact that when people have been getting sick, that their access to care has been challenging. And then when you take a look at what's happening environmentally around the country, you now see that healthcare needs to begin to step up and play a role. And that's where he set these two very significant but meaningful moonshots that we're going to hear about on this episode.
Can you imagine a world where, I love his idea where he says, instead of going to Medicare for all, let's go to primary care for all. What if you were a primary care doctor and you didn't have to worry about whether you're going to have EM code 1 or 2 or 3 or 4 and all that, and whether you could actually spend 15 minutes listening to your patient instead of getting on your computer and worried about, what the code was going to be for this visit? Wouldn't that be so much better for the patient if we could figure out how to just organize that and pay for it? I guarantee you, I bet we wouldn't be paying any more than what we're paying right now.
No, and Peter, that's really the purpose of this podcast, which is to get those ideas out there so people can begin to start asking the questions that you're asking. And it sure makes a lot of sense. And so if we can get more thoughtful people asking those questions, I don't see why we can't get there.
Well, he was a great guest to have. They're doing great things at the Providence system. I follow it very closely, and they're moonshots, but they're not things that are out of the realm of possibility on primary care, or looking at the way that hospitals are big organizations, lots of buildings, lots of energy consumed. How can they be more green? How can they be more efficient? I'm glad he's thinking about it.
Yep. So why don't we hear from Rod Hochman?